Here is exactly how the CRCST exam works and how to pass it. Certified Registered Central Service Technician is the entry credential for sterile processing, and it is one of the few healthcare certifications you can sit without a degree, without a prerequisite course, and in some cases before you have finished the hands-on hours. The credential is issued by HSPA, the Healthcare Sterile Processing Association, and the exam is delivered at Prometric testing centers year-round. Sterile processing technicians decontaminate, inspect, assemble, package, and sterilize the reusable instruments a surgical team depends on. Patients almost never meet you, and they are relying on your work anyway. That is why the certification exists and why the exam is written the way it is. The exam is 150 multiple-choice questions in 3 hours. Only 125 of those count. The other 25 are unscored pretest questions, scattered randomly, impossible to identify, and they cannot affect your result. Unlike some computer adaptive exams, this one lets you mark questions for review and change your answer later, so a hard question early is not a trap. There is no published passing percentage. Your raw score is simply the number of scored questions you answered correctly, and the passing point was set by a criterion-referenced standard-setting method. Content experts estimate how likely a minimally competent technician is to answer each question correctly, and psychometricians turn those estimates into the cut score. So you are measured against a fixed standard of competence, not against the other candidates in the room. Now the requirement that surprises people: 400 hours of hands-on experience in a sterile processing department on a paid or volunteer basis. HSPA breaks those hours down for you: 120 hours in decontamination, 120 in preparing and packaging instruments, 120 in sterilization and disinfection, 24 in storage and distribution, and 16 in quality assurance processes. You can take those hours in either order, and this is the choice that decides your timeline. Option 1, full certification, means completing the 400 hours before you test, documented by your supervisor. Option 2, provisional certification, means you pass the exam first and then have 6 months to complete and submit the hours, witnessed and signed by a manager above you in the department. Miss that 6-month deadline and you forfeit the provisional certification and have to retake the exam. There is a one-time 2-month extension, but only if you are actually working or volunteering in a department at the time. The exam covers 7 areas: departmental considerations, cleaning, decontamination and disinfection, preparation and packaging, the sterilization process, sterile storage, transport and inventory management, patient care equipment and distribution, and professional development and human relation skills. HSPA publishes the subdomain weights in the separate CRCST content outline, and that document is worth downloading before you build a study plan. 2 more mechanics worth knowing. Once your application is approved, you have a 120-day window to schedule and sit the exam, and is annual. 12 continuing education credits a year of a technical nature, relevant to sterile processing. Here is the insight that changes how you should study. Almost every question on this exam is really asking the same thing: what is the mechanism, and what does that mechanism prove? Not which brand, not which minute count. If you learn why air defeats steam, why a chemical indicator cannot prove lethality, and why saline destroys stainless steel, you can reason your way to answers you never memorized. And you will still be right when the standards revise. 3 real questions from the bank. First, an instrument that will enter sterile tissue and the vascular system is classified how, and what processing does it need? Under the Spalding system, it is critical, and it must be sterilized. Spalding classifies by the infection risk of the tissue the device touches. Anything entering sterile tissue bypasses the body's defenses, so any surviving organism goes straight into a sterile site. Items that only touch intact mucous membranes are a different category, and those need at minimum high-level disinfection. Second, a steam load finishes. Every external and internal chemical indicator changed correctly, but the printout shows chamber temperature dropped below the required exposure temperature during part of the exposure phase. What do? You do not release the load. You report the cycle failure, reprocess the items, and document the corrective action. Release requires that the physical, chemical, and biological monitors are all acceptable. A chemical indicator only shows its location, saw certain conditions. It never overrides an out-of-range physical monitor. Third, a wrapped tray arrives in the operating room and the indicator tape on the outside has changed color. What has that established? Only that the package was exposed to a sterilization process, distinguishing it from an unprocessed package. That is all a Type 1 process indicator is designed to do. It says nothing about conditions inside the pack, nothing about whether every critical variable was met, and nothing about sterility. If an answer option promises you sterility from an external indicator, that option is wrong. So how do you prepare? 4 things. 1. Drill practice questions until the reasoning is automatic, and pay attention to the pattern that decontamination, packaging, and sterilization carry the bulk of both the hours and the questions. 2. Master the vocabulary precisely, because this exam lives on distinctions: critical versus semi-critical, cleaning versus disinfection versus sterilization, and the indicator types. 3. Take notes on every miss and rederive the mechanism rather than rereading the fact. 4. Read each scenario for what has already been established before you choose. Many items give you a monitor result, a device type, or a point-of-use detail that eliminates 2 options immediately, and candidates lose those questions by answering from habit instead of from the scenario in front of them. Quick recap: 150 questions in 3 hours, of which 125 are scored, and you can mark and change answers. Pass or fail against a fixed competence standard with no published percentage. 400 hands-on hours before the exam for full certification or within 6 months after it for provisional. 7 content areas, and the exam rewards mechanism over memorization every single time. Practice free at .com/en/sterile-processing. All 5 sections, in English, Chinese, and Spanish. Good luck on your exam.